Hello, doctors. Are you a diabetologist or maybe you are an ophthalmologist and you are maybe a healthcare organization which is planning to conduct diabetes retinopathy screening camp? If you are planning or you are in the process, this is going to be a very useful for you. Even if you have previously conducted any campaigns or screening camp, please watch this tutorial. This is going to be a super detailed tutorial and you will be definitely getting some ideas which you might not have been aware previously. So watch this video till the end. My name is Dr. Nitin. I am a MBBS graduate and I am an alumni of IIT Kharagpur and I am Calcutta and I am expert of healthcare technology and healthcare management. So this is the plan that I'm sharing with you, which I guide my existing customers who are working with me, and this is what they are going to follow. So I'm sharing that exactly same plan with you, and I hope this will be a very useful plan for you. So without further delay, let's start like how you can arrange a successful campaign or screening camp for your uh, diabetic retinopathy screening. So the very first step is to understand about the planning and coordination because without if you're not doing any plan, you are definitely going to fail in this venture. Okay. Uh, so planning is comprised of different aspects. First, you need to establish a committee, a small committee, formal committee for the camp, which can include your healthcare professionals, volunteers, and event organizers. Then you need to collaborate with third party or some external agencies or organizations for seeking some kind of support or resources. It could be local general practitioners, or it could be any other local NGOs or any eye care centers. Uh, you can contact other fellow ophthalmologists or maybe even some diabetes support groups which are working for various patients or this kind of their families. So you can contact this kind of diabetes support group. You can also secure some permissions from the local authorities, government authorities, or local healthcare organizations, uh, government organizations, because you will need that permission to conduct this kind of screening camps. So this is very critical to begin with the planning aspect of successful diabetes screening camp. Then you need to focus on the promotion and outreach because I have seen many times doctors plan for the camp, but they do not give appropriate attention to promotion of uh, uh, conducting that camp. They just hope that it's a free screening camp and patient will visit obviously, or maybe they do some kind of smaller campaigns uh, which may not be like reach to the target audience. So if you want to build a mega, even a smaller camp or maybe even big or mega camp, this plan is going to help you. So you need to create that awareness through either social media. You can utilize some local newspaper or local television channels. You can contact the local community radio stations also. You can print and distribute various flyers, posters, or information brochures to your target population area. You can communicate with the local general practitioners or even other ophthalmology institutes, or maybe even local pharmacies where your target population is staying. So you can target these areas. So you can also involve some local influencers, local politicians, local leaders whom people are following, or if you think they would be beneficial in promoting your message. So you can contact this kind of people and tell them about your screening camps. Then you can the next part is arranging the venue or the place. The place you need to arrange for the logistics because it should not happen that on the last day or last minute you are arranging for the things and those kind of things. So choosing the venue is one of the critical aspects because you need to book maybe that facility in advance. Or maybe even if you are conducting at your own place, your own clinic or your own hospital setup, then also you need to take care of some aspect. So make sure that your venue is centrally located. It's accessible easily from maybe from railway station or bus station or maybe even any public or private transport that should be easily accessible. There should be enough space for like depending on how many people you are inviting, you need to have sufficient space for those many number of patients, or you can consider patients and their relatives will also join with them. So you should have enough space for screening area, particularly one waiting area or waiting lounge. Then you can have arrange some educational session. So you can have maybe a seminar room or presentation room where while the patients are waiting, you can maybe just display some television where you are educating patients through some videos or maybe some through brochures, or even if you don't have this kind of TV screens or projectors, you can utilize a volunteer who can talk about this kind of thing, or maybe even a doctor can discuss about these things while the patients are waiting in waiting area. Then you need to take care of basic amenities for the patients and the staff or your volunteers for the chairs, tables, any uh, medical supplies or medicines that you are planning to distribute through your camp. Then one of the critical things is you need to have registration desk. So this registration desk will be a maybe a table or with some computer or laptop, so that you can enter the data, which will be useful for you in future and just to analyze the camps also. Okay, so you need to have that registration desk. Talking about registration desk, you should make sure that just to understand how many people are visiting. While you are promoting, you can ask the visitors to register in advance so that you know how many people you can expect in the camp. And that will give you idea whether your promotion is working or not. Then, once you are ready with this, you need to prepare and plan for screening process because you might have done it previously, but still a kind of mock drill or some training is essential. Maybe your staff is changing or you are doing the camp after very long, or maybe you are just doing it for very first time. In that case also, you need to understand this process and you need to train your staff and volunteers so that they understand what all steps needs to be done, what all tests needs to be done, what all things needs to be discussed with the patient, and this kind of thing. So you will get a mock drill for this thing. So you can plan for training your healthcare professional to conduct their retinopathy screen, what all tests you will be doing. Then you need to have this screening process where you have registration desk, eye exam center, and a consultation room or maybe a consultation chamber. You can plan that. And while doing this, you need to make sure that because it's very common practice, it's a camp, so you are doing it in open area and all those things. Though if it is a camp, make sure that you give appropriate privacy to your uh, participants or the patient. Okay. Then the next aspect is about educating and counseling those patients. So it might be difficult to do such kind of one-to-one counseling at camps area. So there are few aspects, like there are two options. Either you can invite them to your clinic for one-to-one consultation, or you can arrange a webinar, or you can arrange a education session for mass education kind of thing. So while doing this, you can do a regular, like on daily basis, you can do patient education activities. If you want to know more about patient education activities, let me know in the comment section. I will create another tutorial for same, where like how I am doing. this kind of patient education activities for my existing customer, I will give you that plan. Uh, so you can arrange for educational sessions about diabetes and its impact on your eyes and vision, and why your regular screening is required or checkup is required. As I mentioned, you can provide one-on-one counseling, either in the same location if you have enough staff members, or you can invite them into your clinic. You can, at the same time, it's one of the easiest way is to distribute some brochures or some booklets to the participants, patients. Uh, it can be in multiple language. Maybe say you can have one in English, Hindi, and maybe some local or regional language. So if you want any kind of this assistance, let me know in the comment section. I will guide you on how you can design and create this kind of pamphlets and booklets for your patient. Then you need to work with your volunteers so that they are prepared for the camps, because they might not be aware about various things. So you need to train them. So it begins with the recruitment of the volunteers, and just allocating the different roles, like for registration, for guiding the patient, for providing any kind of refreshment if you are arranging that, and assisting the healthcare professionals, doctors and nurses. So this kind of volunteers you need to recruit. You can recruit these volunteers from NGOs or from some colleges where students are keen to participate and volunteer into such kind of activity. You need to conduct training based on like how you are planning your camp. You need to give particular training to these volunteers so that they are comfortable with the flow and the task. They are aware about what things need to be done so that your patients get better experience even if it is a free screening camp. Then you need to have a partnership and sponsorship from pharmaceutical companies, any medical device companies or supplier, pharmacies, or any other organization you can support in your cause. Uh, I know it's by government, it has been mandated that you cannot take sponsorship from pharmaceutical organizations. But this is if you are doing for a good cause, I think you should consider reaching out to these organizations so that it can help the patients, because the camp you are doing is for the benefit of the patients, so that you are doing it with the mindset that it will help them to identify the problem about their vision, and then you can manage their any health problems. So that's why it's a very social and very noble cause that you are doing this kind of camp. Then you can, like, even if you are taking sponsorship, you can acknowledge them through various channels, and it's okay to be transparent about if you are seeking some kind of help, because it makes you more authentic. It presents you that you are not doing any illegal or any wrong like financial frauds or transactions. So you can acknowledge this kind of people because you are working for the good of the community and your patients. After this, once you like do some screening, you can invite these patients for various follow-up and uh, recheck-up thing. If you want to do some advanced testing or some additional testing or those kind of activities, you can invite them for follow-up visit. So if you are you are just a general practitioner, then in that case you can refer them to appropriate local ophthalmologist, which is nearby to the that particular patient's area. So that you have to work as a team so that that patient gets appropriate follow. If you are apart from this screening, if even if you are planning to like if you are struggling with referrals, patient referrals, I would be happy to provide you a detailed guidelines and support for managing your referrals very efficiently without losing. Those referrals, if you want to build that kind of system, just get in touch with me. You can let me know in the comment section. I would be happy to develop this kind of systems for the doctors so that they can refer their patient easily without losing any referrals. It will be beneficial for you, it will be beneficial for your patient, and it will be beneficial for the doctor whom you are referring. So let me know in the comment section if you want to have that referral system. Then you can provide this information to the local clinic or the practitioners or even the specialists. Whatever information you are gathering from the screening, you can help them. Or maybe if you are working with some NGOs or some healthcare organization, you can discuss with them and work out with them and share this information with them so that they can further plan. Like if that location, if you need particular topic to be focused, say let's say cataract or maybe diabetic retinopathy or hypertensive retinopathy, those kind of things, you can plan for the future activities. So that's why it's working. It's very beneficial and essential to work in a team. Then you have to make sure that you are gathering all the required data, because once you have that data, you can do further analysis by maintaining like appropriate records, and you can analyze them, like how you can plan and make it better in the future, so that your future can become more successful, and at the same time you also get the ideas what kind of health problems are prevalent in the community, so that it will be beneficial for the patient. Then you need to arrange for feedback from the your uh, participant patients or even from the volunteers, just to understand how is their experience, and the medical team also, medical and paramedical team. You can gather their feedback also so that you will understand are there any deficiencies in your planning or in actual execution, and maybe you can work on those things in your future camp. So it's very essential to gather the feedback for the evaluation purpose. Then, last but not the least, is to have that gratitude and recognition for all the volunteers, for the sponsors, for the patient participants and their families, or any person or any organization those are involved in making this kind of camp successful. You can give them certificates. You can give them some tokens of recognition. So that kind of felicitation is essential as a symbol of gratitude and recognition. And after this, you can create case stories or studies around this training camp, and you can publish it through again through your social media, or if required through scientific journal. How was your experience of your screening camps and how it has helped the patients or maybe even your organization to identify particular health issues and all those things. So I hope this session was useful for you. And if you feel that I have provided all the required information, please share this uh, tutorial with your friends so that they get also benefited from this tutorial. And if you feel that I have missed some point, please let me know in the comment section. I would be happy to look forward those comments. And if you are new to this channel, please subscribe to this channel where I share various tips, tutorial, ideas, strategy for doctors and their clinical practice, whether it's a small clinic, whether it's a hospital setup, it's a diagnostic lab. I want to help the doctors to grow to this, their clinical practice. So I hope this tutorial was helpful. Please let me know your thoughts in the comment section. Till now, till then, next episode. Bye from Mark.